Well, joining me now is Dr. Ofer Levy. He is Director of the Precision Vaccines Program and a Senior Physician in Pediatrics at Boston Children's Hospital. It's good to have you on the show.
Thank you for having me.
Of course. I want to start with this full approval of the Pfizer vaccine by the FDA. What does it actually mean for the medical community and for the public in general?
Well, it's a very good sign. It means that the sponsor, in this case Pfizer, has provided additional information, additional follow-up information about the safety and efficacy of their mRNA vaccine against coronavirus. And FDA has reviewed those data and has decided that there's sufficient evidence for safety and efficacy to grant a full approval of the vaccine. This is going to make it that much easier for physicians and doctors' offices across the United States to provide this vaccine, and will give the public an added layer of assurance about how rigorous the safety and efficacy evaluation has been for this vaccine.
But does this then change our approach to the other vaccines currently in circulation? Here in the US, it's Moderna and the Johnson & Johnson shots.
Not necessarily. As you know, those are authorized and have demonstrated safety and efficacy. I believe that from what I'm reading in the media, that Moderna is expected in the coming weeks or months to also submit similar data for their vaccine to FDA and also seek a full approval. Those are the reports I've seen in the media. But all of these vaccines have demonstrated in rigorous and randomized studies safety and efficacy, and we're very fortunate to have all three of these vaccines.
Right. Well, the US has been flagging in its vaccination rates. With this full approval for Pfizer-BioNTech, can we expect a boost?
You know, that's a matter of speculation. I do think that there are some individuals who've been vaccine hesitant, and among some of those, the approval could give them an added layer of peace of mind. The other aspect, of course, is that many institutions now are beginning to implement vaccine mandates or to encourage employees to get vaccinated. I believe the U.S. military recently made a statement about this, Veterans Administration hospitals across the United States, and other private employers. So increasingly, we're seeing either vaccine mandates or if people do not want to get immunized, they might need to be subjected by their employer to frequent testing. So I think you're going to see an increasing proportion of individuals making the right decision, getting the vaccine so they could protect themselves, their loved ones, and their community.
Now, the Pfizer jabs have already been used on kids over the ages of 12. Why does it take so long for approval for children who are younger? What makes them different?
Well, you know, children are not just little adults. Our immune system changes with age. So we cannot just assume, if we see safety and efficacy of a vaccine or a medicine in adults, we can't just assume that's the case in children. That's why we need to do the studies, and they're designed by age de-escalation. In other words, start in adults, then go down into teens, and then to younger age groups. So it takes time to work through all those clinical trials and to gather the relevant safety and efficacy information.
Really quickly, Doctor, we're seeing more children being infected with COVID-19 as the Delta variant spreads. Is this a case of children being particularly susceptible to this mutation, or is this just a numbers game?
Well, thank you for that, and there's need for ongoing research. This is called infectious disease surveillance, monitoring which type of virus is circulating in the community. There are anecdotal reports from different hospitals that in some hospitals they're seeing some more admissions to the hospital among children with coronavirus infection, and in some cases in children who don't have any pre-existing conditions. But we really need more data to better understand this. It appears that the Delta variant does spread more easily than the earlier versions of the virus, and that may be accounting for some of this.
Dr. Ofer Levy, thank you so much for your time. Really enjoyed speaking with you.